I'm washing my hands with alcohol. After this, washing. Okay. After this, I'm wearing the gloves. After this, I'm washing my stethoscope. And I'm checking the patient's ID. Can I please check that? Thank you very much. I am introducing myself. Salman, my name is Abbas, and I'm your nurse. I'm going to be performing head and toe assessment on you. Before we start, would you like to go for elimination? Okay. Now, my 5 questions are: is your rash itchy? Do you know when it starts? Describe your headache. When you wake up, are your eyes red? Do you have any allergies? These are my 5 questions. Now I'm going to be doing the physical. I'm going to be checking his physical appearance. This is general survey I'm doing on him. Physical appearance. So I'm going to be starting from his age. From his physical appearance, the age appears to be somewhere between 17 and 19 years. His body, his skin color seems to be evenly distributed all over his body. Salman's body posture is upright, and I don't see any obvious signs of deformities, physical deformities in his body. His body is symmetrical. His height is approximately, let's check his height. Salman, can you please stand by the wall? Okay, so his height appears to be 178 centimeters, which is quite normal for his age. Let's check this. Let's check Salman's behavior. Salman is well dressed. I can see that. His personal hygiene appears to be good. He's maintaining eye contact and he's communicating well. After this, I'm going to be checking Salman's mobility. Okay. So, Salman, could you please stand and walk a few steps forward and then come back, please? So I can see that Salman's walk is normal. While he was walking, I noticed that his walk was balanced and coordinated, and his body was leaned forward throughout his walk, so which tells me that his gait is intact. After this, I'm going to be checking Salman's breathing. So Salman's breathing is normal. Salman is calm and doesn't show any signs of distress. After this, okay. So after this, I'm going to be checking for the level of consciousness. I can see that Salman is awake. Salman is not sleepy. Salman is fully alert. What's your name?
Salman.
You know where you are?
Yes, at the clinic.
You know what time is it now?
About 10 p.m.
So this tells me, the response from Salman tells me that he's fully alert, he's not sleepy, he's awake. Salman, I'm going to be performing head and eye assessment on you. While doing that, I'll be touching you. Is that okay?
Yes.
Alright. So now I'm palpating his head for lesions, deformities, swellings. Now, while I'm palpating, I don't see any signs of lesions. I don't see any deformity in his head. I don't see any swelling. I don't see any areas which are tender. Salman, do you feel pain?
No.
So Salman does not feel pain. It means his head is okay. There's no problem with his head. Now I'm going to be checking his color, hair color. Salman's hair colors are black, and they are evenly distributed all over his head. And so this is about his hair color. After this, I'll be checking Salman's face. Salman's face is vertically symmetrical. I don't see any signs of swellings on it. The face color is evenly distributed, and I don't see any patches or any different color than the rest of his body. So face color matches with the rest of his body. Now I'm going to be checking Salman's cranial nerve number 7. Salman, can you shut your eyes tight and then reopen them for me so I can see that? Salman, can you show me a smile? Please show me your teeth. Okay. Can you puff out your cheeks? Thank you. Can you lift up your eyelids? So I can see that Salman's cranial nerve is intact because Salman responded correctly to my questions or appropriately to my questions. After this, I'm gonna be doing checking his eyelids, eye assessment. So the first comes the eyelids. I can see the margins of the eyelids are neat and clear. I don't see any crusty formation on them. Then eyelashes. Eyelashes have black hairs on them, and those hairs are evenly distributed. Then after this, we can check the eyebrows. Eyebrows have black hairs, evenly distributed. Eyebrows are symmetrical, and they are in line with each other. After this, I'm going to be looking for conjunctiva. For conjunctiva, I'm going to be opening the eyes like this. I can see the Salman's conjunctiva is white and there are no discharges over there. I also noticed that Salman's sclera is pink and there are no discharges over there. After this, I'm going to be doing the cranial nerve number 3 test. For this test, I'll be using the pen light. Just take a pen light. Thank you. So now before I shine the light, I'm going to be checking Salman. Salman, please look at me. So I'm now trying to find the size of his pupils. So his size, the size of the pupil seems to be 6 millimeters, and both pupils are equal. So I can see that Salman's pupils are round. They are equal in size. They're symmetrical. Now I'll be doing the direct and consensual light reflex test. So direct test, what I do is I'm going to shine the light in one eye. I notice that his pupil constricted. Now shine the light in the other eye and his pupil constricted again. So direct test tells me that his pupils are responding to the light and they are constricting. Now I'll do the consensual light reflex test, in which I'll shine the light in one eye and I'll notice the pupil in the other eye. I noticed that both pupils were simultaneously constricted. Now I'll repeat this with the other eye. So I noticed that when I shine the light on the other eye, the pupil on the left, in the left eye, also constricted. So it means the pupils are working in coordination and they are constricting simultaneously to the light. Now the last test which I'll be doing is the accommodation. Salman, can you please look at this and focus on it, okay? Now this test is called accommodation, in which I'll be checking the response from his pupil. As I move the object close to his eye, I notice that Salman's pupil are also following that movement. It means Salman's pupil were focused on the object when it was far. They were focusing on the object, and as I started moving the object closer and closer to his eye, pupils never lost the focus. They were still focusing on the object. So this was my assessment on Salman, head and eye assessment. Thank you very much, Salman. Nice of you. And assessment is over.